Okay, a lot of parents call our office, reach out to me online, or come to the office wondering, what do I do if I think my child actually has coronavirus? And so if that's a question that you have, this is the video for you. Now, I know everyone out there is really worried about coronavirus. They're worried that that sniffle or that cough that they hear at the grocery store or at church or at school could be coronavirus and not even know it. And so parents want to know, like, what do I do if I actually think that my child has coronavirus? Like, what should we be telling our children? And what should I do if I actually think my kid is sick and they might have coronavirus? First and foremost, I want you to take a deep breath. And then I want you to take another deep breath. And the statistic that I want you to have in your head, which is not shared on the news as much as all the other statistics, is that no children, as of March 5th, 2020, no children have died from coronavirus. Now, what does that say? That says a lot. That says that even though there's been hundreds of thousands of cases around the world, that it is affecting adults, which doesn't give me peace of mind as much because I'm an adult and my parents are adults and a lot of my coworkers and friends and everyone are adults. But it should give you peace of mind that, okay, children are not affected in the same way as coronavirus. Why is that? Because there are a lot of normal coronaviruses going around every year, and every winter kids have coronavirus. Now, coronavirus 19, COVID-19, is this new virus that is sweeping the nation in terms of the news and starting to cross the nation in terms of actual infection. But coronavirus is a normal virus that children experience. And even before all of the news about this, we saw a good percentage of patients that had coronavirus in the office that had colds, that had stuffy noses, that had coughs or fevers. And we gave them the same advice that we're giving patients that actually have coronavirus, which is supportive care, which is taking care of breathing and hydration and closely watching for symptoms. Second, I want you to recognize that coronavirus is like every other cold virus. In children, you're going to see the sniffles, you're going to see nasal congestion and cough and runny nose and sore throat and fevers, and it should pass over the course of 3 to 7 days like the normal cold virus. Now, what you're going to do, instead of worrying or thinking that we need to run to the emergency department or run to our doctor's office, is take a deep breath and realize that the symptoms of coronavirus will look like every other cold virus for your child in the majority of cases. Like I said, you don't need to run to your doctor's office. And the reasons for that are a few-fold. One is we don't have good testing yet for coronavirus, meaning that even if we suspect coronavirus, there really isn't a lot to do in terms of testing for coronavirus. The state lab, the CDC, all those places can do the testing, but for the general public, at this point in early March, we're not doing routine testing for coronavirus. It also runs a risk of, if you run to the doctor's office or run to the emergency department, one, the risk is exposing other people. Your child or you may have coronavirus, but they may not. And so if you run to the emergency department, not only are you exposing other people in the emergency department, the physicians and the staff and everything like that, to a new virus, you're also picking up everything that's already in the emergency department. And if you don't actually have coronavirus, you might pick up influenza, RSV, coronavirus, any of those things from going to the emergency department. What I want you to do instead is I want you to call. I want you to call and find out, okay, what should I do? My 4-year-old is having symptoms. I think they might have coronavirus. What we'll do is take a travel history. We'll say, have you been exposed or done any travel to any of these high-risk areas? What are their symptoms? Are they having difficulty breathing? Are they unable to eat or not making enough urine? Are there signs of dehydration or respiratory distress? If those things aren't present, then more than likely not, we're going to say, well, we would like you to stay at home. We would like you to practice good hand hygiene, take care of fever, help with cough, and then keep us in the loop as symptoms change and monitor for changes. It's not something that requires immediate attention. It's not something that requires immediate hospitalization or a trip to the emergency department. if we're breathing easily, if our fever is controllable with Tylenol or ibuprofen as age appropriate, if we're staying hydrated, then what we're going to do is truck through like every other cold virus. If your child is over 6 months of age, they can have ibuprofen. If they're over 12 months of age, you can add honey for cough as well, and that's going to be your best bet for cough medicine. You don't have to pick essential oils. You don't have to do elderberry syrup or Zarbee's or other over-the-counter cough and cold medicines. They're just not effective. They're not effective for regular cold viruses, and there's no evidence that they're effective for coronavirus either. So save your money, save putting your peace of mind or your well-being or sanity in some over-the-counter cough or cold medicine, and look at your child and say, okay, he's breathing comfortably, he's breathing easily. I can just go ahead and keep watching. And I've talked with my doctor's office and they said keep watching. I'm going to avoid exposing others, and I'm going to keep him home and safe and try and limit the spread. Now, what I want you to do, it's hard. It's hard to have the idea that my child could have coronavirus, but the likelihood is that it will pass just like every other respiratory illness that they've had. Oftentimes, kids get a respiratory infection every month, and so kids' immune systems are very robust at fighting off these new viruses because they get a lot of practice in the first few years of life. And so what I want you to do is try and remain calm. I want you to try and think about not exposing others. Think about calling your doctor's office, and think about just looking at your child and saying, well, they have a cold. It could be coronavirus. It could be something else. It could be just a regular old cold virus. Let's look at the big picture rather than jumping on, I think they have coronavirus, we got to get tested in the emergency department, we got to run to the hospital or urgent care or the ER, or just show up at my doctor's office. If you have questions, call your doctor. If you have more questions, call again. Get the information that you need to make the right choice. And please, 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 take a moment and share this message. Share it with other parents who are worried or not sure what to do about coronavirus, because it will help to bring peace and calm when good educational information is shared. Keep up the good work. Keep in touch. Keep calm. Keep washing your hands.